Hi everybody, Dr. Bryton here for 2-Tip Tuesday. Today I have a special guest. This is Dr. Christine Glazer, a palliative care physician from the greater Los Angeles area. And I don't think there's a better opportunity here to talk about pain with regards to your oral health and medications and treatments and what we can do. If you're aware of what's been going on recently with regards to opioid awareness, we have seen quite an epidemic that has broken out throughout our country with regards to opioid addiction, as well as death that has come from opioids. And so what I want to talk to you today is with regards to treatment of pain, how we can come up with some alternatives, things like ibuprofen, things like Tylenol, what can we do, maybe even in combination. So Dr. Christine's going to help us out here. So tell me a little bit about ibuprofen, your thoughts on ibuprofen. How can we use it?
So ibuprofen itself is a well-known anti-inflammatory drug. So it decreases inflammation and therefore decreases swelling and the pain that comes along with these two things. So ibuprofen itself, if you're going to use it as a pain reliever, you want to take anywhere from 400 to 600 milligrams at a time.
Yeah.
Minimum 400 to get the anti-inflammatory effect, and then you can take a standard dose would be 600 milligrams every 6 hours.
Okay.
The max you would want to take in one sitting is an 800 milligram dose, but I'd recommend sticking with the 600 milligrams every 6 hours. I'd like to mention Tylenol along with that, if that's okay with you.
Yeah.
Because in oral pain, we actually know from a study that ibuprofen, which is Advil, or Tylenol, which is acetaminophen, those two in combination with each other are actually shown more effective for oral pain relief than things like Norco, Vicodin, other opioids.
Like an opioid,
Yeah,
okay.
and with that, basically, the ibuprofen alternating with the Tylenol, you can be taking something every 3 hours because you're going to stagger them.
Yeah.
So you can take something fairly frequently and be getting the pain relief from these two drugs together. It's almost like combining apples and oranges for nutrition. They're working in two different mechanisms.
Yeah.
So you're targeting the pain in two different angles. And
so if we're doing ibuprofen and we're doing at least 400 to get that anti-inflammatory, doing right around 600 every 6 hours, and then we throw in the Tylenol, how much Tylenol would you want to take? You know, in the medicine field, a lot of times we'll do 1,000 milligrams like every 8 hours, but if we wanted to stay in that 6 hours, how many milligrams would you try and go for with the Tylenol?
Good question. So 500 to 600 milligrams.
Okay.
A max of Tylenol per day, which again is acetaminophen or Tylenol.
Yeah.
They're the same thing. The max per day on that is going to be 3 grams.
Awesome.
So 3,000 milligrams or 3 grams. The max for the ibuprofen is going to be 3,200 milligrams.
Yeah.
But again, if you stick with the doses we just talked about and you can stagger them every 3 hours, so you're taking each one of them every 6, alternating with each other, then you should be safe and be getting pretty good pain control.
That's awesome.
For the oral pain. So,
Awesome.
And then one last thing I'd say, the benefits of these drugs, other than the good pain relief, when you're using them together, is you don't get all the side effects. So you're less risk of things like constipation. Addiction is the big one that we want to avoid, because we know that people that actually end up abusing these drugs more often than not start them just as for pain relief when they have a pain situation.
And that's common in dentistry. We saw, exposing young children, 16-year-olds with their wisdom teeth getting removed. We expose them to things like Norco and Vicodin. And so now that we have some alternatives, we can lower the risk of developing or further worsening any kind of opioid addiction or epidemic there. So
that's really the big one, and then things like constipation, nausea, even change in mental status if you're using these drugs. You can have a normal mental capacity if you're going to take Tylenol and ibuprofen as compared to Norco and Vicodin and these opioids that can mess with your thinking. So.
Well, thank you so much for the insight. Hopefully that's helpful for all of you out there. Again, Dr. Christine Glazer here. This is awesome. Glad we were able to do this. If you have questions, please ask below. We'd love to answer them. Comment, like it, share it with anyone you think it might be helpful for. That's the goal of this. So have a great rest of your week. Thank you so much.
Thanks,
Thank
everyone.
you. Appreciate
Thank you.
it.